Friends, welcome to Jaypess Institute of Medical Science. Today we shall discuss about Metrorrhagia. Metrorrhagia. First, what is Metrorrhagia? Metrorrhagia when there is excessive bleeding from the uterus between menstrual periods is called Metrorrhagia. This is a common problem, especially for teenagers and women nearing menopause. How does it occur? Hormonal imbalance. The imbalance is sometimes caused by improper use of hormones, medicines such as birth control pills, polyps, which are growths on the cervix. The opening of the uterus or inside the uterus, polyps are usually non-cancerous. Fibroids, which are non-cancerous growth in the uterus. Infection or inflammation of the uterus, cervix or vagina. Erosion of the cervix. It is the loss of surface skin of the cervix. Sometimes IUD is used inside the uterus. IUD is intrauterine device or sometimes the woman uses birth control pills. That's why also the menorrhagia may occur. Endometriosis. When the uterine tissue growing outside the uterus. Adhesion. Scar tissue inside the uterus. Dry vaginal walls from decreased estrogen from after menopause. Chronic medical problems, for example, thyroid problems, diabetes, and blood clotting problems. Sometimes medicines such as blood thinners and stress. Cancer of the cervix or other parts of the uterus or vagina. In menorrhagia, patient may need a blood test or procedure such as endometrial biopsy. Here, a catheter is inserted into the uterus through the vagina to remove the cells of the uterine lining for examination. And sometimes ultrasound scan also helpful. Then there is another test, that is sonohysterogram. It is the ultrasound scan is done after fluid is injected through the tube into the uterus. This test allows to look for the problems with the lining of the uterus. Hysteroscopy. Insertion of a thin metal tube with a light and tiny camera through the vagina and cervix into the uterus. This allows to see the inside the uterus. Hysterosalpingography. Here, the dye is injected into the uterus and fallopian tubes through the cervix. X-ray are taken. The dye outlines the shape and size of the uterus and tubes. By this, any pathology inside the uterus could be revealed nicely. Now, the treatment. The treatment depends on the cause of the problem. For example, if the patient has a hormonal imbalance, doctor may prescribe hormones. If an IUD is causing the problem, it will be removed. Erosion of the cervix may be treated by removing or destroying some of the cervical tissue. Sometimes surgery is needed. Possible surgical treatment include dilatation and curettage, in which tissue is scraped or suctioned from the uterus. Hysteroscopy to remove a polyp. Hysterectomy, which is removal of the uterus. If the cancer is found, it may be treated with a surgery radiation, chemotherapy, anti-cancer drug, or any combination of this treatment. Friends, now we have come at the end of this video. If you like this video, please give a like. If you are new in this channel, please subscribe the channel and push the bell button and give your comment in the bottom comment box. And at last, thank you everybody for watching this video.